Hello, everyone. This is Community Chats from Montefiore Nyack Hospital. Your host is Sandra Arevalo. I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. And today we're going to be talking about cervical health and mainly cervical cancer prevention because there are a lot of women who unfortunately don't get screened for cervical cancer. And those are the cases that we are seeing are ending with not so much positive results. So we have two experts today with us, and you're not going to believe when I tell you that Dr. Brian Lott is right now joining us from Ethiopia because she works here in the Bronx for Montefiore, but she also does research abroad, and she's joining us all the way from there. And we also have Emily Botigig, Dr. Emily Botigig, and you're here, right? You're not that far away. Okay, just making sure. And they are two experts on cervical cancer, and they are experts on educating women also about the importance of screening. So without further ado, why don't we get started? I know that you have a PowerPoint that you would like to share. And maybe you want to tell us a little bit about the work that you do. So maybe you want to start, Dr. Lott?
Sure. Thank you for the invitation today. Able to
Okay, maybe you want to turn the camera off because it's
not
cutting
super
off a little.
Ethiopia. Is this better?
Yes.
Helps, but apologize
Yes.
if time hearing me. Just
Okay. We're losing you. So
Sandra, okay.
it's cutting on and off, unfortunately. So while we
Okay.
reconnect with Dr. Lod, do you wanna introduce yourself, Dr. Buttigieg?
Yeah, I can talk a little bit about kind of some of the screening events that we've done. So, I'm Dr. Buddigig. I'm one of the OBGYN general doctors. And I connected with Dr. Lau probably about a year and a half ago now when I started here at Montefiore. Um, my participation has been in our Saturday pap smear screening events. So, um, at one of our clinic locations on, I think, 5 or 6 Saturday mornings a year. We offer screenings for women that are uninsured, underinsured. Um, Saturday time because many of our patients are working multiple jobs. It's hard for them to get to clinic appointments, and so they really appreciate kind of a flexible time that they're more able to come. And we offer cervical cancer screening with pap smears. We partner with some medical students in the area who actually do education with the patients beforehand so they can understand cervical cancer, what a pap smear screening is, and understand what their test results are going to look like so the patients get some education. And recently, we've even added in education on screening for other types of cancers, such as colon. And hoping
Mm,
to even add on things like breast cancer screening in the future. So, trying to be kind of comprehensive. But our main focus over the past year has been cervical cancer screening. Since I work here as well, I'm able to follow up the results and get patients in if they need additional testing and even treatment, all with the goal of obviously catching cervical cancer or pre-cancerous changes early and preventing people from getting to the point of the cervical cancer.
mhm. So, Dr. Buttigieg, you just mentioned
Mhm.
something interesting that triggered a question in my mind. So,
Sure.
are cervical, breast, and colon cancers related?
Um, for the most part, fortunately, no. There are some more rare genetic syndromes where different types of cancers can be related. But cervical cancer, for the most part, in the US is caused by the HPV virus. That's a virus that is sexually transmitted. Um, that virus can be associated with cancers in other body parts, things like oral cancers, penile cancers. So it can cause cancers in other parts of the body, but for the most part, we see it in cervical cancers.
Okay, thank you. Maybe we recover the connection with Dr. Lott. Dr. Lott, you there?
Yes.
Perfect.
Let me try again. Is this better?
Much better.
Okay, good. Apologies about that. And just let me know if I cut out again.
So do you want to introduce yourself? We definitely want to know about you.
Yeah, so great to meet you all. I work with Dr. Bettigig at Montefiore Einstein. So I'm actually on the Albert Einstein College of Medicine side of things. My background is in public health. I'm an epidemiologist, and I primarily focus on cervical cancer research. So I study why people do and don't get screened, kind of all of the human health behaviors associated with cervical cancer. And so really my job is to help promote it, help people understand why they should be getting screened. And so really excited to be here today to share a little bit more.
Thank you very much. So I'll invite you now to share your screen so that our attendees know we're going to be going about what is cervical cancer, HPV, the importance of screening, some screening guidelines, etc. So we are able to see your screen now.
All right, let me get into presentation mode here. And also, I am happy to take questions as we go. We'll leave some time for questions at the end as well. But for the participants, if you have any questions kind of as we're going along, please do feel free to use the chat, type those in. Sandra will be taking a look and making sure we answer those as they come in.
Yes, thank you so much.
All right. So we already introduced ourselves. I'm Brianne Lott. Also joining me, Dr. Emily Buttigieg, and we're really glad to be here with you today. We're going to talk a little bit about what cervical cancer is, what causes it, understanding risk factors, and then we're going to get into screening and prevention. We'll talk about follow-up care that might be needed for folks who might have an abnormal screening result, some resources, and then time for questions. So what is cancer? Most of us are familiar with the term, but maybe don't know exactly what it is. So cancer is caused when cells within the body grow and multiply uncontrollably. So this can happen throughout the body. There are more than 200 different types of cancers. And today we're going to focus on cervical cancer. So basically that's a type of cancer that happens in the cervix. And the cervix is the organ that connects the vagina to the uterus. So on the screen here, you can kind of see two different views of what the cervix looks like. So you can see this view here where it's connecting the vagina to the uterus. So the cervix is right here. And then this is what it would look like if you were to look through the vagina at the cervix. So this is kind of similar to what your provider is going to see when they're doing your cervical cancer screening. So what causes cervical cancer? And actually, Emily already mentioned that most cervical cancer in the United States is caused by human papillomavirus. So this is a sexually transmitted infection. And it's very, very common. Most sexually active adults will be exposed to HPV at some point in their life, but most people won't know that they have been exposed or have acquired this infection. So typically what happens is your body will fight it off with your immune system. It'll clear on its own, and it really doesn't present problems. For some people, it can cause symptoms, and for some people, persistent infection can lead to cervical dysplasia or cervical cancer. So risk factors for cervical cancer, while HPV is the thing that causes cervical cancer, there are other factors that may increase your risk for developing this disease. Some of these are what we call modifiable risk factors. So they're things that you might have control over that you could change. And then some of these are things that are non-modifiable risk factors. So these are going to be things that you don't have control over. So risk factors include your sexual history, obviously with HPV being a sexually transmitted infection, things like early initiation of sexual activity, multiple sexual partners, and unprotected sex all increase your risk. Also, some lifestyle factors like smoking can increase your risk, and that includes secondhand smoke as well. And then having a weakened immune system or infection with other STIs. And then, of course, we know that for a lot of cancers, family history does increase your risk as well. So when it comes to preventing cervical cancer, there are different ways that you can prevent it. Primary prevention is the type of prevention that is going to stop HPV from actually infecting you or causing cervical cancer to begin with. So we have a vaccination against HPV. This is pretty new. Most people have heard about it, but it's really only been in practice for a couple of decades. So depending on your age and your health history, you might not have had the chance to get vaccinated against HPV when you were younger. It's something that's typically targeted toward adolescents. So right now, we actually start vaccination for HPV beginning at age 9, and we're really looking to vaccinate people before they become sexually active so that we can prevent that HPV infection to begin with. Then for secondary and tertiary prevention of cancer, these are both related to screening. So whether or not you have been vaccinated against HPV in the past, screening is super, super important because it helps us to find precancerous cells before they have a chance to grow into cancer. So we can actually treat those precancerous cells. And if, cancer does have a chance to develop in your body, of course, we want to find that cancer early so that we can also get you treated to minimize negative outcomes. So what does screening for cervical cancer look like? The Pap smear is the most widely available screening test in the United States. And you may be familiar with this test. It's been around for quite some time. A lot of people have already had a Pap smear in the past, probably get them on a pretty regular basis. But if you haven't had one before, the procedure basically involves a healthcare provider taking a swab of cells from your cervix, which are then analyzed under a microscope to detect any of those abnormal cell changes. This is a diagram of what that procedure looks like. So a speculum is placed into the vagina so that the provider gets access to your cervix. They'll use a swab or a brush to take the cells off the surface of the cervix and then take that out. And I want to also pause here to ask Dr. Emily if you have anything else that you would like to share about what this procedure typically looks like.
Yes. So, the procedure itself, I would say is, fairly quick. It takes a couple minutes. Some women can have some discomfort even from kind of speculum placement. It does put a little bit of pressure um, on the structures next to it, so things like bladder and the rectum. But in general, women do pretty well with the screening test. Um, at the time of screening, we also look at the cervix, and so if there's ever anything abnormal that we see, um, we could talk about kind of seeing that as well. So not only is it kind of a screening test with the PAP, but we're also taking a look at that area.
Awesome, thank you. And another type of testing is something called the HPV test. So this one is more recent. And this is, it basically involves the same procedure where a provider will do that same sort of an exam. They'll take a swab of the cervix, but this time the test is looking for the HPV virus, and they're looking for high risk types of that virus. And basically, it's a way to help us understand which patients might be at high risk of developing cervical cancer based on the presence of that virus. There is also an opportunity to do something called co-testing. So a lot of providers will do both the Pap smear and the HPV test at the same time. But partly your eligibility for these two different tests is going to depend on things like your age and your medical history. So your provider will help you decide if you need one or the other or both. And screening guidelines, these are always changing. So it's, I think, a good reminder to let you know what they look like at the moment. The current screening guidelines suggest that all women should undergo periodic screening. starting at age 21 with a pap smear, and then extending up until age 65. And again, based on your age category, that will determine if you need to get a pap test, an HPV test, or co-testing, and how often you need to get it. So it's typically every 3 years or every 5 years if you get the HPV test or co-testing. And then once you reach age 65, you typically don't need cervical cancer screening anymore. There are some exceptions, so you always want to consult with your healthcare provider just to make sure that you don't need that screening anymore. Certain cases where you might need continued screening is if you've had abnormal PAPs in the past, and so you'll maybe a higher risk patient that you need to keep a closer eye on that. One other thing to note is that if you have had a hysterectomy in the past, that's also a situation where you typically would discontinue screening. So you wouldn't need to continue getting cervical cancer screening if it's a full hysterectomy, if everything has been removed. But there are some partial hysterectomies where you might have some anatomy still present, and so you might still need to get screened. So you just always want to talk to your doctor. And then I am also going to ask Dr. Emily to share a little bit with us about possible follow-up care. So most of the time when you get your screening, you'll have a normal result, and that's great. And that means that you're clear until you're due for your next screening. If you were ever to have an abnormal result, there are some different things that your healthcare team might recommend for you. So this is going to depend on exactly what your results look like, whether you have a low-grade lesion, a high-grade lesion, if you have that HPV positive result or not. And so some of the possible options are that they might ask you to come back for repeat testing. They might also just use a conservative watch and wait approach. So if you're a very low risk patient, they might just say, yeah, we'll take a look when you're ready for your next screening. And we're making note of this, but we're just going to kind of keep an eye on it. In certain cases, you might need something called a colposcopy, where basically the healthcare team is going to take a closer look at your cervix with a microscope. And then if you have abnormal cell changes that need to be treated, there are different options of ablative and excisional treatment, basically where the abnormal cells can be either burned off or kind of scooped out of there so that your cervix can regenerate nice, healthy cells. And Dr. Emily, anything else you want to share?
I can share a little bit more. So talking specifically about the colposcopy, I know, it can be very concerning or anxiety provoking whenever we get an abnormal result. Most of the colposcopy and biopsies we don't find cancer, which is good. And the overall risk, even when you have an abnormal pap smear, is low. The good the thing I reassure all of my patients on is, cervical cancer is overall kind of slow growing. The importance is that you're staying kind of up to date with all of this follow-up care. Because if you are, most likely we would kind of catch and treat something in the pre-cancer phase before it becomes a cancer. With the colposcopy itself, it starts out very similar to a pap smear. So placing that same device, the speculum, to look at the cervix, we put a little vinegar on the cervix, and that changes any abnormal cells to a white color. And then, like Dr. Lott said, we look through a special camera to see if we see anything abnormal, and if we do, we biopsy. And again, most of the time, those are kind of reassuring, and we just watch people very closely to ensure that their body will clear the cells and the virus on its own.
Great, thank you. So how to get screened. So now that we've kind of talked about the different types of screening, why it's important to get screened, understanding your risk, and regular screening guidelines, if you would like to get screened, there are actually multiple ways that you can access this sort of health service. So one way that I think a lot of folks are really familiar with is making an appointment with their gynecologist. So you're definitely welcome to do that. You can also ask your regular PCP, and I feel like not a lot of people know about this option, but your regular PCP should be able to either provide the test for you or refer you if needed. And then a third option would be to find a community screening program. So outside of making an appointment with a gynecologist or a PCP, there are some programs that are just focused specifically on cervical cancer screening. And like Dr. Buttigieg mentioned in the beginning of this presentation, we actually have one such program. So I did want to provide a little bit of information about that as well. So this is called the Montefiore Cares Initiative. It's again for women aged 21 to 65 who have not been screened in the past 3 years. Whether you have insurance or not, you're welcome to come and get screened with us. And our next screening is actually planned for February 8th. So this is going to be one of those combined cancer screening events that we were talking about, where actually cervical, prostate, and breast cancer will all be offered. So it's kind of around Valentine's Day. The idea is that couples can come in, the women can get their cervical and breast cancer screening, the men can get their prostate PSA exam, and we are currently registering patients for this event. So if you are interested in getting screened with us in the Montefiore Health System, you're welcome to either call the number on the screen, or you can also scan that QR code. That'll take you to our online interest form. You just fill out a little bit of information with your name and your phone number, and someone will give you a call back soon. And then last but not least, we have compiled a couple of resources for you. So this is really just intended to kind of give a high-level overview, but have linked some additional resources. We can put these in the chat, and we can also make them available to you after the presentation. One of these is a tool to know your own risk. So we talked today about some general risk factors, but this tool, you can kind of plug in information about yourself to get an individualized plan of what your screening recommendation is when you need to get screened and how often. There's also a good handout from American Cancer Society that talks a little bit more about HPV for adults, including how it's related to cervical cancer, but also those other cancers that we mentioned. And then if you are wanting to learn a little bit more about the screening procedures, especially maybe if you are hesitant to get screened and just want to see a little bit more about what that looks like, we also have a 3D interactive demo of the screening procedures themselves. And with that, we would be happy to take any questions.
Well, thank you so much, doctors, for this comprehensive information. Not only it's comprehensive, but you made it very easy to understand. So I appreciate that you did that. I do have a follow-up question for your screenings. Do people need to live in a specific zip code, or people from our area in Rockland County, maybe Westchester, they can go to you as well?
Yeah, sorry, I think my internet was cutting out a little bit. So typically our initiative is focused on folks that live in the Bronx, although we don't have like a very strict inclusion criteria that says you have to live in the Bronx. So if we get folks from other areas, we're also welcome to inviting them to our events as well.
Very good. Thank you so much. And I would like to invite our attendees to see if they have any questions. Let's talk a little bit about, in the meantime, let's talk a little bit about the HPV vaccine. Can you tell us a little bit more about it? Like, when are you supposed to get the vaccine? How old do you need to be, etc.?
I'm happy to answer that one if you want, Dr. Lott.
Yeah, that's great.
So, as Dr. Lott said, it is somewhat of a newer vaccine. So many women, above the age of 30 didn't get it as part of their childhood vaccines. Nowadays, kids get it starting at age 9, and if they get it before age 15, it's a 3-dose, but only need 2 of the doses. So we give it to all boys and girls from 9 onward. Right now, it used to initially be approved up to age 26, and a couple years ago, the FDA increased it to age 45. So women and men between the ages of 9 and 45 can get it. Again, it's a 3-dose series, so you get 1 shot and then another shot about a month or 2 after that, and then the last shot 6 months after. There's really good information that even 1 or 2 shots do make a significant difference in preventing the vaccine, although obviously as a physician, I'm going to recommend that you do the full course of it. But it's an extremely effective one. It prevents, there are hundreds of different strains of HPV. This one targets 9 strains. So there is still a chance you can get HPV even if you get the vaccine, but this protects you against the ones that are most likely to cause a cancer and genital warts.
Do we have any data about the effectiveness of the vaccine?
Sorry, Dr. Ladd, I can't tell if you're unmuting. We do. It is very effective. It's, I think, well into the 90%. I don't know the exact number, but extremely effective.
Okay,
And we're getting kind of more and more data as this new generation kind of is becoming sexually active. They got the vaccine as children. We're going to learn even more about kind of prevention. Obviously, right now, the majority of people that have gotten it got it after they became sexually active. So it's possible they were already exposed, but now this new generation will have gotten it before, which is why we target children and adolescents, because ideally, if we can give it before someone becomes sexually active and prevent them from getting the virus at all, that's the best strategy.
How, as health professionals, how are we disseminating this information to let parents know about the vaccine and how important it is that their children actually get it at a younger age?
Yeah, so we partner with our pediatrician colleagues because, again, as you alluded to, this is done often before they've come and met with me. And so, we partner with our pediatricians. There are, on a national level, there are TV commercials. Not sure if you've seen for the vaccines called Gardasil. So kind of targeting things on more of a national public outreach level as well. But really, this involves us talking with our pediatrician colleagues to ideally be getting the vaccine before they've come and met with me.
Okay, beautiful. Well,
Yeah,
thank you so
and
much. We don't have any other questions that I see here on the screen. So I appreciate your time. I appreciate that you're coming from so far. And Dr. Buttigieg, thank you for helping Dr. Lott as well. And I'm sure that I'll be happy. Oh, that was the other question that I had. If you have any flyers to your screening event, I'll be more than happy to, post them for our community. So thank you so much, and thank you to our attendees, and I'll see you next week. We're going to be talking about human trafficking. So please join us for that. Thank you.
Thank you so much for having us. I really appreciate it.
Bye-bye.
thank you.